Good morning. My name is Major Tawny Cowan-Zanders, the Salvation Army's Divisional Secretary for Greater Philadelphia. On behalf of the Greater Philadelphia Salvation Army, including Majors Celestin and Stephanie Nkuku, the Corps Commanding Officers of the Salvation Army West Corps here where you are right now, and whose hospitality we owe a great debt. It is my pleasure to welcome you, the press, Mayor Kenney, Dr. Farley, Councilman Jones, and Commissioner Thiel, to the City of Philadelphia's 8th mass vaccination site, which is being conducted in partnership with the Salvation Army, the Philadelphia Department of Public Health, and the Philadelphia Fire Department. We are thankful to PDPH for their guidance and leadership in keeping us safe and healthy during these challenging days, and we are immensely thankful for PFD for their continued frontline service, both as first responders and now as our vaccinators. Throughout this pandemic, it has truly been a privilege for the Salvation Army to serve the community. Instead of pulling back or becoming paralyzed by the pandemic that swept through the world, we leaned into it, meeting needs at the point of need, at the time of need. Our shelters, our residences, and our community centers remain places of hope and help, sowing peace, love, and compassion. In fact, since March 13, 2020, we have served in Greater Philadelphia alone well over 3 million meals to our community. We stopped counting after we got over 3 million meals. While they're actual meals, we like to say we have provided 3 million acts of love. In a time when hate and darkness attempts to invade our communities, the Salvation Army stands in the way. We refuse to allow the darkness to pass us. We are leaning in with light, love, and compassion. Now, a year after becoming the community's food site, we are pivoting to becoming the community's vaccination site. This is an honor we do not take lightly. This is our community, this is our home, this is our family. We are here for good. And this opportunity to partner with the City of Philadelphia will make the COVID vaccine easier to access for our surrounding communities, especially for those who are Black and brown. They have been disproportionately affected by this virus, and they have had a disproportionate access to the vaccine rollout. We are profoundly grateful and thank you for the work that you are doing for this. Now, it is my distinct privilege to introduce the mayor of the great city of Philadelphia, Mayor Jim Kenney. He has provided historical leadership during these unprecedented times, carrying the concerns of our citizenry on his shoulders and tirelessly focusing on the science that will see us through this moment. Please join me in welcoming the man who has steadfastly led us forward, Mayor Jim Kenney.
Well, thank you very much, and good morning to everyone, and thank you, Major, for that wonderful introduction and for the Salvation Army support. Once again, I would like to thank the many partners who have come together and to set up a COVID vaccine clinic right here in the neighborhood. Thank you to the Salvation Army, the Health Department, our great Fire Department, and Office of Emergency Management, and last but certainly not least, Councilmember Curtis Jones, who's been right by our side the whole time in a productive and very positive way, and I really appreciate your support and friendship. This is now the 8th city-run community-based mass vaccine clinic that we've set up in neighborhoods all across the city. We know that not all communities have suffered equally from this pandemic, so it's important that we target the solution, this vaccine, into those communities that need it most. Getting the vaccine to communities of color, like West Philadelphia, is a top priority of our administration. And thanks to the folks at Salvation Army, we're making that happen and improving access to this life-saving vaccine right here in West Philly. We'll continue to open new clinics throughout Philadelphia, and the Health Department keeps adding new vaccine partners. There are now more than 200 sites in Philadelphia administering the vaccine. More than 100,000 doses of vaccine are being given out every week. That's why over the past few weeks, things have started to feel very different. Yesterday, alongside the Chamber of Commerce for Greater Philadelphia and business leaders, the city launched the Ready, Set, Philly, a new partnership that is planning for how we bounce back stronger than before post-COVID. But to be ready for this is key, that we are vaccinating as many Philadelphians as possible. We urge residents who want to get vaccinated to schedule their appointments at phila.gov/vaccine interest, or by calling 311, by dialing 311, and they will sign you up if you don't have a computer. So thanks again for joining us today. And before I turn it over to Dr. Farley, I just want to say that the J&J vaccine, the one dose is going to double our speed, really put us on hyper speed to get this done. The more people get the vaccine, more people get vaccinated, the better they feel about going out, mingling again, going to restaurants, going to retail, doing the things we're all used to doing before March of last year. So this is a wonderful feeling and a great time of positive energy, and I want to thank you all for being here. So Dr. Farley.
So first I got to start with a warning. As I think you probably know, unfortunately, the health guys got to do this, right? The case rates are rising right now, rising faster than they've risen for months. We're up to more than 400 cases per day. And so while there's so much to be optimistic about today, we're not there yet. You can't throw away the masks. You can't be gathering to people without masks. You have to be very careful right now. I don't want more people going to the hospital. We don't want more people dying from this infection when we're so close to protecting the entire population. Now let me talk more about the positive side of what's going on here today. You know, it's wonderful to be here in West Philly. It's great to be working with the Salvation Army. Thank you very much, Major, for giving us this site. As you know, we are offering vaccines through many different channels in the city. As the mayor said, more than 200 different sites. However, there is a need for a safety net site, a site where if people can't access any other one, we provide it, and that's what this is all about. We have the convention center in Center City. There's doing some 6,000 people per day, but not everyone can get to the convention center. And it's clear many people are just not comfortable, even if they could go down there. So we're doing these clinics in Philadelphia's neighborhoods that are easier to access. We've been all across the city. We've been in North Philly, Giuliani Park, another part of West Philly earlier. We were in South Philly, lost track earlier this week, the Northeast just earlier this week. It's great to be here, sort of far West Philly. Also, a number of the sites initially were run by predominantly health department staff with support from the fire department. The last few are being run by the fire department and EMS services. When people in this city call 911, they know that they can have an ambulance come to their home with people that they trust. They recognize who these people are, do fabulous work, they help their health at that moment. Now this organization is helping out to prevent people from needing to call 911. It's really exciting to see that happening, and all we're hearing is working out extremely well. I want to personally thank Commissioner Thiel and all of his wonderful staff that have made these clinics work so well. They did over 500,000 vaccinations up in in Northeast a couple days ago. We're on track, I believe, to more than 500 here today. So now, ultimately, we need to vaccinate 1.2 million adults in the city of Philadelphia. It's going to be a lot of groups of 500 to get there. But with each group of 500, we're 500 people closer to ending the epidemic. Thanks very much. With that, I'll turn it over to Commissioner Thiel.
Thank you, Dr. Farley, and thank you to all the partners who are helping to make this important site happen. And most of all, for me at least, thanks to the almost 3,000 women and men of the Philadelphia Fire Department and Office of Emergency Management, who, in addition to the 800 to 1,000 emergency incidents, those 911 calls that Dr. Farley was talking about earlier, every 24 hours, are now helping us proactively address this COVID-19 crisis. We have been part of the COVID response since day one, working side by side with the health department, incredible leadership from our mayor, our managing director, on and on and on, partnerships with city council, so many different community groups. And, response is what we do. That's in our DNA. At the same time, we are huge proponents of prevention. Fire prevention. Everybody knows about our smoke alarms, and please check the smoke alarms. Make sure they work. Because we're still having fires. We're still having those daily emergencies and disasters that we respond to, along with partners like the Salvation Army, to take care of our citizens. In fact, just last night, we had another structure fire that displaced some folks from their home. That said, we are so excited about being able to do something in advance and prevent folks from getting sick with this dread disease. We've lost 2 of our own members to COVID-19, so we know it's real. We know that as Dr. Farley is fond of saying, we might be done with the virus, but the virus isn't done with us. So to be here and be in all of our neighborhoods, as we are providing those response services, to be out there in neighborhoods administering this vaccination, whether through churches or other facilities, partnerships like this, supporting the Black Doctors COVID Consortium, which we're also doing today at the Leocoris Center, or next week, really on Sunday, we're going to be opening another facility at 78th and Ogons in a partnership with the Department of Public Health. So for us to be able to do this and to participate in this way is, I mean, it's honestly, it's a little bit, it's tough for me to keep my composure because we have so much wanted to be part of this proactive piece. And we're excited. We're excited to get more vaccine. We still need more vaccine. Remember, all of these vaccines are safe and effective. If you come to one of these sites, you're going to have them administered by trusted providers. Our paramedics are the best in the business with great partnerships. So thank you all. Please get vaccinated. And council member?
I said this yesterday in the chat at the chamber, and I hope they would have read it, so I'm going to take this opportunity to say it to you guys to your face. During calm seas and sunny skies, any sea captain will do. But during a storm, during rough seas like pandemics, only a skilled captain will get us through. And when I look at you, all of you, I look at people that under a great deal of pressure, when there are no playbooks to pull from, you guys did the right thing for our city, averted more casualties than we could have had, and you do not get enough credit where credit is due. And for a district council person, I just want to publicly thank you. So for today, with our partners in the Salvation Army, along with the fire department, location, location, location. It matters. We are strategically between several zip codes that are high risk. If you look outside, there's a senior facility with people who have mobility issues. So this location is important. If you throw a rock in another direction, you have the Philadelphia Housing Authority, where the messaging about the importance of vaccines, if they have to go far, wait long, they're not going to do it. So this location is essential to get more millennials and others to get to this location so that we can develop herd immunity. So I'm grateful to the partnership you see here. Salvation Army is always been our partner here and always, and hopefully forever, ever, will always be here. But we are thankful to pull together this coalition of people to provide this needed service during this pandemic. Thank you.
Questions from the press? I'm sure you'll be. Not all for me.
Dr. Farley, just, in all the clinics, the neighborhood ones that you're doing so far, do you think that the message is getting out to people that it's safe to get the vaccine? Are you still seeing a little bit of hesitation from some of the underserved neighborhoods that maybe don't feel comfortable getting the vaccine? Or do you think that that's something the messaging has gotten through and they are okay with it?
I definitely think that there are people who are hesitant. I'm not saying that they don't want to get it. I think hesitant is a better term for it. But the people who come to the clinics clearly want to be vaccinated. That's what I've seen. Many people are thrilled to be here. They're excited to be here. We're just giving them access. Later, we're probably dealing with the people who are a little reluctant. And we have a media campaign that we're going to be working on to try to bring those out and outreach efforts. So the approach we're going to do is we'll shift as we get past the people who are enthusiastic and move to the ones that are just a little more hesitant.
Dr. Barton, do you have a better idea of why the cases are rising now?
No more. I do know that the percent of viruses out there that have these variants that are more easily spread is rising in the country and is particularly high in New Jersey. But I also know that people are traveling more with the good weather, the spring, and so it means they're in contact with more people. So I'm not sure which of those two is more important. The message is still the same. The risk is rising right now. You got to wear your mask, got to keep your distance. We're going to be past the worst of this soon with vaccination, but not quite yet.
As far as testing sites, because now we're hearing so much about vaccination sites,
Right.
what role are testing sites right now playing? And are you starting to close them down and transition them to vaccination sites, or is testing still important too?
Testing is still important to do. There are some organizations that are doing less testing. We've seen less demand for testing than we saw before. We still want to make it available. I'm hoping that as we vaccinate more people, case rates will go down, we'll have fewer cases out there. As we get fewer cases, testing is actually more important because we want to identify people quickly who do have the infection and then do the contact tracing and isolation and quarantine to sort of stamp out the last few vestiges of the virus in the city. We're a long way from that now, but that's the future of this, is we vaccinated a lot of people, then we need to have more testing and more rapid testing so that we can do the containment.
Has the city seen a consistent delivery of vaccine? Has it been more consistent across the board and increasing? Have you seen any disruptions in your vaccine supply?
The vaccine supply has been good. It's been increasing, and the doses we've been delivering has been increasing. We almost doubled when we opened up the convention center from 54,000 doses delivered 1 week to actually over 109,000. It's more than doubled. We're well over 100,000. We're going to be putting out a plan later today that our target is by the end of April we'll be delivering over 150,000 doses per week. So we're absolutely ramping up. April is going to be a really key month. We're going to increase the percentage of people in the city who are vaccinated. The higher that percentage is, the safer we all are.
And with all these precautions, have you seen a proportionate decrease in COVID-related deaths?
The information on deaths tends to lag behind, so it's really too early to say. I'm hopeful that even with a high case count, we may have a relatively low number of people who die. That would be a sign we're vaccinating the right people. We're vaccinating the people who are vulnerable.
One quick question, just to clarify, I was unclear on your numbers. You stated Northeast Philadelphia Fire Department distributed how many vaccines?
It was 525, if I'm not mistaken, do you know?
Okay.
And is it like also by appointments only, or walk-ins are accepted? Or?
For all of them, we encourage people to schedule appointments. Most of them, those appointments are filling up. For some of them that they don't fill up, we do take walk-ins.
And that's the case here.
I think all the appointments are filled today. I don't know if we're all filled today, yes.
How many vaccines around are you guys coming to?
It's over 500 today that we can do, yes.
And I know we ask you this every day, but every day we're also told that it could change.
Right.
Do you have an idea of how much of the Johnson & Johnson you're going to get? I don't know if you've had any meetings.
Well, on Tuesday I said, we don't think we're getting any this week, and we don't know anything about the future. Tuesday afternoon, we were told we're getting 9,000 doses this week. Okay, but we don't have any idea what we're getting in the future. So it comes when it comes, and we're pleased to get as much as we can, but we can't predict.
So then, just to clarify, latest update with Johnson & Johnson, Philly will receive 9,000 this week, and to be determined moving forward?
Correct. It's not on any routine schedule like the other vaccines. They just, when they have it, they give us some, and that's all we can say at this point.
And forgive me, today is what shot?
This is the Johnson & Johnson.
Any more questions, folks?
Wonderful. Thank you all.
Okay, thank you.